Welcome to the real, the free. It's authentically Amy, come talk with me. Love, sex, truth, no shame inside. We're getting deep, and it feels so right.
Hey sexy besties, welcome back to Authentically Amy. I am Amy, I'm a certified sex and relationship coach, and with me today is Katie Usher. She is a pelvic floor therapist. Katie got her undergrad degree at UF, Go Gators. She got her PT degree from the University of Miami. She started her pelvic health business in 2018. It's called Kaizen Pelvic Wellness. She specializes in pregnancy and postpartum issues here in South Florida. So, very excited to have Katie today, and we are gonna be talking about all things pelvic floor health and wellness. So Katie, thank you so much for being here today.
Yeah, thank you for having me.
So I'm gonna start with the most basic question imaginable, because I'm sure other people like me are sort of completely new to this world of pelvic floor everything. So what is a pelvic floor? What are we even talking about?
It's a great question. When I was in my first year of PT school, we did an anatomy dissection and we did not even dissect the pelvic floor. So it's definitely something that most people don't know about unless you go Googling, but even then it can be kind of confusing. But the pelvic floor is pretty simple. It's a hammock-like structure of muscles, and there are 3 layers. So the deepest layer looks like a hammock. The most superficial layer is what people think of when they think of like the vagina. It's more of, you know, like a triangular base meeting in the middle at your perineum, and then it includes your external anal sphincter. And then there's a second layer as well that helps with extra continence, but it's a group of muscles and they house your pelvic organs.
And so what role do those muscles play in sort of both general wellness and sexuality?
So when thinking about the pelvic floor, there's the function of the pelvic floor. This is there are 5 S's. So one of them being support. So they help support our pelvic organs. Sexuality is one of the S's because the first layer of the pelvic floor brings blood flow to the clitoris. So that is what actually allows for arousal. Stability, so it's actually a part of our deep core. So the pelvic floor is actually a canister. It's the bottom part of the canister. So you have your diaphragm to the top, pelvic floor on the bottom, and then your abdominal wall muscles. So it plays a really important role in core function. And then another one they say is sphincteric. So our continence support, basically. So the bladders in women or the urethras, and women are much shorter than a man's. So our muscles help with continence of bowel and bladder. And then the other part is more what they say like sump pump. So it's more like lymphatic flow and circulation. There's a lot of blood flow, lymph nodes.
That the muscles are kind of helping pump through. Oh, that's so interesting.
So it's a lot more than people think. And the pelvic floor is so interesting because, you know, if you were to think of if you're having bladder issues or period issues, or, you know, from a medical standpoint, you're thinking like, I have to go see a urologist, I have to go see a gynecologist, I have to go see a GI. From a therapy standpoint, we are looking at all of those muscles combined. So a lot of times if people are having issues that are both related, so say like a woman's having period pain, but she's also is prone to UTIs. Those are things that we're looking at both organ places and how the muscles are interacting with those organs. So
it's very holistic.
Yeah, exactly. We're able to look at everything.
Got it. So you kind of look at it holistically instead of like treating just one part of the area.
Right. Exactly.
Very interesting. And so what exactly does, if someone's having pelvic floor issues or they suspect they might be and they come to you, like what does a pelvic floor therapist sort of do in general?
Yeah. So historically, I feel like people have always thought pelvic floor was Kegling. And so it's like, I don't need to go to someone, I can do my Kegels. It is so much more than that.
So much more, obviously.
Yeah, so we do, at our practice, we do, and I think most people practice this way, it is very holistic. It's not all internal work. Usually there is the outer musculature of the pelvis that we're working on. We're looking at how the pelvic floor is interacting with everything in the area. So low back, abdominal wall, how your diaphragm's moving, how your breath is looking, what exercise, like it also depends on what people are coming in for. But if it's pain related, we also want to know what the surrounding muscles are doing. So there's usually a portion of it that is external, and then there's a portion of it that is internal. And so the internal portion, which is a lot of times what people are wondering about, is it's mostly soft tissue. It's very gentle. It's like myofascial release it's very similar to like what PT would be outside of the body, but it's inside the body. So we're coming onto like that hammock of muscles and just checking to see what the tone is like. And if we're finding scar tissue or tightness or pain or prolapse, like we're just looking at what everything is going on in there, and then we're doing whatever we need to do. So if it's a tightness issue, we're working on relaxing the muscles. If it's a weakness issue, we're working on strengthening the muscles. And so it's usually a lot of soft tissue, and then it's also working on the coordination of the tissue. So can you do a Kegel? Can you bear down? Can you coordinate the movement of the pelvic floor with your breath? Because a lot of it is more of that like nervous system and like neuromuscular education, and just like making sure that all of that is working the way we want it to.
That's so interesting, the point about like working on other surrounding muscles, because I don't know if other people, like I don't think that's something people would think about intuitively, but it makes sense because if you go to physical therapy, let's say for your back, right? Sometimes they're like, well, we have to strengthen your core. Or you go for like your lower back and they're like, we have to work on your hamstrings, right? Like all those things are so interconnected. So it's interesting that in this, it's sort of the same thing. It's like, yeah, you might have a pelvic floor muscle issue, but we also have to make sure that everything else that's supporting it is doing its job.
And I think that's how therapy should be, is you're looking at the person as a whole. A lot of, like, I had a patient today who she is coming for pelvic floor issues, but she had a hip labral issue and had a surgery on that. And so then now as she is pregnant, that tissue isn't stretching the same way that the rest of the body is. So that's creating issues in her pelvic floor. So when she comes in, we're working on the hip and the pelvic floor. Does that make sense? And
absolutely,
a lot of people have those type of issues where it's like a history of back pain, but also pelvic issues. So we're kind of working on both in tandem because most of the time they are related.
I just think that's so fascinating. And I think obviously it makes so much sense, but I don't know that everyone would have realized that without you saying that. It's so fascinating. So really quick, who do you help with these issues? Like, is it just women? Is it women and men? Is it mostly one type of person? You know, like who can benefit from different pelvic floor health and wellness, obviously, and visiting you or visiting a pelvic floor therapist in general?
Everybody. I've seen children. I've seen 84-year-old women. I've seen men. It really just depends on what's going on. The market that I think knows of us the best is pregnancy and postpartum. So that's definitely like what we specialize in. But I've worked with children with digestion issues. I've worked with postmenopausal women with hormonal issues and pain with sex and prolapse. I've worked with people post-surgically, like after hysterectomies or C-section, because a lot of times even in the birth world, people think pelvic floor work is still only related to having a vaginal birth, which is very much not true.
That was going to be one of my questions is, definitely, one, why pregnancy and postpartum people are the most likely to seek out pelvic floor therapy? Like, is there something going on during that time that's causing them to need it more? So that's question one. And then question two is there a difference between vaginal delivery and C-section in terms of like its effects on pelvic floor wellness and needing pelvic floor therapy? So it's a two-parter.
It's a really great question. I think both populations could definitely use pelvic floor therapy, but for which reason, that depends, because the issues between vaginal and C-section are different. So typically, and this isn't always the case as most things, but like typically with a C-section, the things that women are dealing with are scar tissue above the pelvic floor. Mm-hmm. And so it's actually creating a pulling from above and scar tissue work through the abdominal wall that we're working on releasing. Because a lot of times after C-section, that scar tissue can create issues with the bladder, and it can also create issues with pain with sex because there's a little bit of a tautness of the tissue. Whereas vaginal birth, those things tend to be more of like leaking issues or pain with sex or prolapse where the organs are feeling low. So all of which, even with a C-section, I would still be doing internal work, at least on a evaluation basis, to just make sure that the tissue isn't too tight and that they are not going to develop issues in the future. I think this type of work is preventative healthcare, and in many other countries they do this no matter what.
Oh, interesting.
And it's covered. It's not that way, and it should be. But I think we are getting there as a country slowly. But I do think this is work that everybody could use.
But why is it specifically, like, what is it about pregnancy, I guess, that's like, and postpartum that's is it just like sort of an hyper awareness of things going on in that region of your body because you just had a baby? Is it just that like you said, like sometimes in vaginal delivery, there's just the complications that lead people? Yeah, so is it just kind of?
No, it's a great question. And the pregnancy postpartum period is very similar to menopause in the sense that you're getting a huge hormonal shift at that point. And so usually if there are issues, they're popping up in this time. Because if you do have a lower functional reserve of the pelvic floor muscles, meaning like when you have the urge to pee, if you have a low functional reserve, that would basically mean your body can hold it, but to a certain degree. Then when you add in the hormone of relaxin, which causes everything to relax, that functional reserve goes away and then you're leaking all the time. So a lot of times things will pop up that were still an issue before pregnancy, but become more obvious during that time.
So absolutely. So relaxin, is that a hormone that is in pregnancy, postpartum, both?
Relaxin is a hormone that comes on when you're pregnant and it allows the body to stretch to accommodate for the growing baby.
Makes sense.
So it's systemic. It's not just for the pelvic floor and the uterus. So that is a time where your joints are just looser in general. So there is a lot more laxity in the system. And yeah, it stays as long as the mother is breastfeeding. So it doesn't, those relaxin levels don't typically go back to normal until 3 months post ending of breastfeeding.
Oh, wow.
So it could be years that women are dealing with the increased laxity in the system, which some women do great with because, again, there's a spectrum of tissue laxity in the system at baseline or hypermobility. So women that tend to be more hypermobile have a little bit of a harder time generally with the increased relaxin, where someone who is maybe stiffer the relaxin does their body super
wonders.
Yeah.
Interesting.
So sometimes we'll see, like, if people are having a lot of pain with sex before pregnancy, it actually gets better with pregnancy because the relaxin allows things to calm down.
That's interesting.
Yeah, it is interesting.
Okay, but so the things you're seeing, it's not just pregnancy related, obviously, right? You said everyone can benefit from this. So what are some other, like, sort of, I guess, ways that this manifests that people might not even realize that it's related to their pelvic health, right? They might be having a symptom that might just, in their brain, they don't even realize it's something that's worth pursuing, like pelvic health assistance.
So what pelvic floor therapists are working on is the tone of the tissue of the pelvic floor muscles. So one sign to tell you if you are having, say, like a tight pelvic floor would be bladder issues. So either like you're having to go to the bathroom every 30 minutes to an hour, or when you do have to go, there's like a really strong urgency. Frequent UTIs can be an issue. Constipation could be another sign that you're having a lot of pelvic floor issues or that there's a tightness there. Hemorrhoids are another thing. Pain with sex, period pain. A lot of times with cycle pain, it's actually just a general tightness in the tissue, and as the uterus is expanding before it bleeds, it can create a lot of pain. And as we start to balance through the pelvis and soften that tissue and get everything like more connected, a lot of times those pains go away.
Interesting. And what is the connection between like the pelvic floor muscles and the increased UTI? Because that's so interesting, because right, like a UTI is just, usually it's some sort of bacteria gets into the urinary tract and causes an infection. So how does that like relate to the pelvic floor muscles? Because
if your bladder gets, if you get a UTI and there's an infection there, a lot of times what will happen with that is you'll have your antibiotics, the pain will go back to normal and you're good. Sometimes though, the pain will linger even though you're getting a test that's saying that you don't actually there's no bacteria in your urine. When that happens, it's usually just a residual inflammation of the tissue.
Oh, okay.
So just calming all of that down takes pressure off of the bladder, because if the tissue around the bladder is tight, it's going to compress externally on the bladder, giving it the same sensation of irritation.
Wow. So that's a lot. So it really impacts like everything.
Everything.
And so, yeah, because you also mentioned like hemorrhoids and constipation, and I'm like, wow, and I guess logically it makes sense, because if those muscles play a role in, obviously, elimination. Good word. I was like, what euphemistic word am I using for pooping today? Love it. Right. For eliminate, like if that plays a role, then obviously if those muscles have any sort of like difficulty working, I could see how that would play a role in like not being able to go as easily, which is so interesting. Because I do think most people, if they're having constipation, probably try like laxatives or go to a gastrointestinal doctor. And I'm guessing a lot of gastrointestinal doctors are not like, you should go see someone for your pelvic floor.
True. And to be fair, there are a lot of reasons that cause constipation.
Of course.
So it's not, but it can be definitely like a huge part of the issue, because if the tissue is tight and it's actually creating, it's just like a cinched hose, right? It's creating an elimination problem, so you're getting a backup. And then, so a lot of times pelvic floor therapy is actually a holistic part of, it's a piece of the holistic care of the person, because if say it's like something like SIBO where there's a bacterial overgrowth in the gut, well, is the bacteria overgrowth happening because there's a peristalsis problem or an elimination problem and the stool is sitting there too long? So
makes sense.
I'm not saying that people shouldn't go see their specialist by any means. I'm just saying this is definitely an essential part of the care when people are dealing with those issues.
And especially I would think too, if it's like having multiple symptoms, right?
Right. Another one that I forgot to mention is like post-ejaculatory pain too in men. It's because a lot of times people think this is only for women. So it's like, well, when would a man come in? That tends to be like getting up a lot in the middle of the night to pee. Again, pelvic pain, just generalized pelvic pain. Sometimes people will have like, a fall on the tailbone or some type of orthopedic issue, or it can just be stress induced, because the pelvic floor is definitely an area that people tend to hold tension if they're dealing with, and it's very similar to what I would talk about, like cervicogenic headaches, where people get headaches related to stress. It's the same type of thing in the pelvic floor. The pelvic floor is very much under nervous system control, and if we're all kind of in this fight or flight situation where people are stressed out, that tends to be an issue that tends to block things up.
Right. The fight or flight is always like, it's so interesting because it's like evolutionarily, we still haven't caught up to where we are. And so like our bodies have a hard time distinguishing between like everyday stress and like being chased by a tiger or something. So, right. And so, that your nervous system can be in overdrive. And the other thing you said too is so interesting about clenching them, like holding tension in those muscles, because I think most of us, I definitely think a lot of us understand like here, we all like hold a lot of tension. I've heard, women tend to hold a lot of tension in their hips. So it's interesting to think maybe, someone could be holding it in their pelvic floor area as their tension center, which is like, obviously you'd want to release that pressure.
And it's really interesting because from looking at the nervous system, so you have your parasympathetic nervous system and your sympathetic, and we know, sympathetic is fight or flight, parasympathetic is the more of your rest and digest. Well, those nerves come out of your cranium and your sacrum. So, and the sacral nerves are the same nerves that innervate your pelvic floor. So if there is an imbalance there, like a lot of the work that we do is actually working on activating more of those parasympathetic nerves, because from a rest and digest standpoint, that affects your ability to digest your food. It affects your ability to have an orgasm. It affects your ability to birth a child. And because if you're not really able to tap into your parasympathetic nervous system, everything is going to be super clenched. So
that makes perfect sense.
Yeah, it's interesting.
And then, so one thing I definitely want to make sure we talk about for sure is the painful sex concept with those muscles, because I just think it would be helpful for people to understand a little more like why something going on with the pelvic floor muscles would lead to pain, whether it's for women or men, because you said sometimes men have post-ejaculatory pain. So like sort of what is the connection between those two?
Typically it's tight musculature, and that can be for various reasons. I mean, we know like 1 in 4 women deal with some sort of sexual trauma in their past. So it could be a bad sexual experience.
That then causes your muscles to kind of like, so when you go back to have sex again, everything's clenched because you have anxiety or some kind of anxious reaction.
Right.
Okay. All right.
Yes.
All right. That makes perfect sense. Okay. And how else can it manifest?
A lot of times it can just be tight tissue, where if the tissue can't relax, then it's basically like you're rubbing up against muscle and spasm. It's not going to be comfortable for anyone. But if we go back to the whole idea that the first layer of pelvic floor muscles send blood flow to the clitoris, if those muscles are really tight, that can impact a woman's ability to orgasm.
Or even to get like aroused, like maybe to have enough circulation for like proper lubrication and all of that as well.
Right.
Okay.
Exactly. Mm-hmm.
That's interesting.
And then the other part, which is not necessarily like we can't do a ton on the hormonal side, but sometimes it is hormonal and sometimes it has nothing to do with that. It's more so just there's not enough estrogen or something where the tissue isn't able to lubricate as well. And so that is where, as part of an disciplinary team, we would be like working with their gynecologists and stuff. There are a lot of over-the-counter products that are not necessarily estrogen based, but can be helpful with like hyaluronic acid from a lubrication standpoint. But yeah, it's really just kind of teasing out if it's more so like a tight tissue, or if it's something where they did have a childbirth and there was stitching, because if there's tearing and then there's stitching, sometimes the tissue doesn't heal the same way. So then the scar tissue is pulling or causing issues there.
And so I guess I'm thinking, like, to put it in terms of like a body part that people can really like resonate with, like, I guess if you had like a back muscle, right? Let's say like your lower back is in like a spasm or really tight, and then you try to like go for a run, right? Something like that, like it would hurt, you'd be in excruciating pain, right? When you have something like that, you just wanna like lay down and not move. But so I guess it's kind of like that. If your muscles, if your pelvic floor muscles are like really, really tight, and then you're trying to use them to have, you know, penetrative sex, is that like a fair analogy?
Yes,
okay.
Definitely. It is a fair analogy. And the other part of it is too, and that's why I spend so much time talking about the nervous system and the breath, because it's so much related to your parasympathetic nervous system. If your body can't relax, like, and it could not be related to pain, it could just be you're stressed, or if you're a mom of young kids and you like can't turn that part of your brain off, that will also impact the like sexual function there. And it's the same thing. I have this conversation with women on the prenatal side too, when they're prepping for birth, because the history of our evolution, again, what you said, hasn't caught up to the times, and our bodies are not meant, you're supposed to birth in the same place, same type of place that you have a bowel movement or have sex. You should feel safe, it should feel calm, and that's not always the case in a birthing environment, right? So, but it's the same thing, like you probably wouldn't want to be having sex with a ton of lights on and all of those things, but it's, so from a nervous system standpoint, you have to be able to be in a situation that allows your body to relax enough to
Interesting. Yeah, we
tap into that side of things.
Yeah, we definitely talk a lot about, like in my field, right, as a sex coach, like relaxation is always coming up, because that's like the number one thing I always tell people. You have to set the mood, you have to be relaxed, because it's very hard, right, like to enjoy sex if you're not in that state for a lot of the same reasons, really. So, and I do want to come back to one other thing about the painful sex, because so obviously it makes sense if the muscles are tight why penetrative sex would be hard. And I guess, but for like, you know, oral sex or something that doesn't, you know, or using a vibrator, masturbation, something like that, where there's nothing inside the vagina in general, like I guess it could still cause pain because of those issues we were talking about with the blood flow and the lubrication and hindering like the experience of orgasm, right?
Right. And a lot of women are able to orgasm with a vibrator, but then not penetratively for that reason.
For that, okay. So there could be both scenarios.
Right. So it just kind of takes an evaluation to tease out what exactly is the issue. Because you could, if a woman is able to orgasm but not penetratively, it could be positionally, it could be tight internal pelvic floor. There are some women who just have a really hard time orgasming in general. And when that is the case, we're looking at like what the nerves are doing, what the tone of the tissue is doing, because sometimes it is more of a weakness issue and just activating that tissue.
Right, because the muscles play a role, right? Because an orgasm, like this is another thing we didn't even like define, because we always assume, I think people understand what orgasm is, but really what it is contractions of your vaginal muscle.
Right.
That is like at base, like that's really how it's defined, because it can be so different. The experience of orgasm is different for every woman.
Right.
Right. But so obviously, right, like I guess we should have said this at the beginning, but like backing up, like it's, if your muscles are not properly functioning, like of course there's going to be some difficulty with orgasm, right? Is that fair to?
Absolutely.
Yeah.
So a lot of what we're doing is actually looking at what we talked a lot about, like the tightness and the pain side of things, but we're looking at the full range of the tissue. So can the muscle engage? Can it relax? Can it come back to baseline? And then can you bear down? That is a full like range of motion of the tissue. So a lot of times we'll find that people, they fall into different categories. Everybody kind of thinks of themselves as having a weak pelvic floor if they have issues of leaking or pain with sex or something like that. A lot of times it is a hypertonicity issue, meaning the muscles are tight and we're working on down training them. There's also the scenario where women can squeeze their pelvic floor, but then they can't bring it back down to baseline. So there's
so they kind of get stuck at a squeeze.
Right.
Oh, because yeah, you got to be able to both squeeze and relax.
Squeeze and relax.
And that's kind of like what a Kegel is too, right? I mean, I know
A full range of it, yes.
we do more than Kegels.
Yes,
we got
yes.
it, but that is kind of the general concept.
Right.
Interesting. So that would make sense why that can be helpful. So I do have another question. Obviously, I have lots of questions. But for someone, let's say there's someone who's, maybe getting to the point where they're thinking about getting pregnant, but they're like, oh my God, I'm terrified because I don't want to have pelvic floor health issues. Is there something that, like, what advice would you give someone in that situation? And also, like, is there anything people can start doing, like, proactively, right? Maybe whether they're thinking about getting pregnant or not, really, but like younger people to kind of like prioritize their pelvic health?
Yeah, it's a great question. I think from a preconception standpoint, if people are thinking about getting pregnant, the first thing is to address any issues if there are existing, meaning like if your cycle isn't regular, figuring out why that is. If you're having pain with your cycles, getting that addressed. If you're having any digestive or IBS issues, like getting those things addressed. And that's where sometimes a pelvic floor evaluation can be very helpful to just tease out like how is all of this looking? Is your range of motion good? Are the organs sitting in a good place? Is anything irritated? And then from when women are pregnant, from a birth prep side of things, it's usually like on a monthly basis because things are changing so much that we're working on making sure pelvis is balanced and then staying pain-free through the pregnancy and then prepping for what pushing looks like, what labor looks like. How are we going to manage this to hopefully optimize that whole experience so that there's minimal trauma, if hopefully none, and then to also help the postpartum experience be better. So I guess from a standpoint of like what preconception wise, it's really just addressing any issues that people are currently having so that they have a better experience going forward, because things tend to get worse during pregnancy and postpartum.
Of course.
And an example that I'll give a lot of times is like a fall. I've had a lot of people that have been in like cheerleading or dance where if they have a fall in a tailbone, which is a common thing, but that is something like just a blunt trauma that can cause a tightness issue. Those are the things that like people aren't necessarily putting the dots together around what can impact labor, if the muscles are having a hard time relaxing.
Makes sense. And so I guess, have you seen, like, if you work with women while they're pregnant, does it tend to have more favorable results postpartum?
100%.
Oh, that's great. So that's great to know. So someone maybe who's thinking about getting pregnant would be smart to come in for an evaluation and like maybe try to work with a pelvic floor therapist throughout the pregnancy to minimize the effects down the road.
Right. I first got into this thinking that postpartum care was revolutionary. Like I just felt like it was preventative healthcare because when I was working in the hospital, all of the referrals we were getting were postmenopausal women that were leaking. Most of those issues could have been a lot easier to prevent had it been initially postpartum, because a lot of times those things start, the daily like needing to wear a pad, those things start with like the sneeze pee.
Right. We've all heard about the pee when you sneeze. Yeah.
Right, and it starts so mild at the beginning that nobody tends to like deal with it at that time, but the issues tend to get worse with time, not better. So I just felt like postpartum was such a huge step for preventative healthcare. And then the more I was working with people, I was like, no, it's not the postpartum stuff, it's the prenatal stuff, because if we can help minimize birth trauma, then it changes the entire experience for women and their families and the babies and all of that, because if a woman is not doing well postpartum, nobody's doing well.
Right.
A big enough transition as it is, and then to add in, like healing from a 4th-degree tear or something like that, then it's,
It's hard to take care of a baby if you're in perfect health.
Right.
It's even harder to take care of a newborn if you have any sort of like personal injury or health issues going on as a result. It's exhausting either way. But yes, it would make an already difficult situation worse. And this is another interesting question. And then I want to get to some more practical stuff, but is there any sort of like link too between pelvic floor wellness and like infertility? Like, have you seen any patients where they're having trouble getting pregnant, they go through the pelvic floor therapy and it kind of can assist with infertility issues?
Yeah, that's a great question. Yes, pelvic floor can help with some fertility issues. There are a lot of reasons.
There can be a lot of reasons, right? But so is it a reason sometimes for some people?
For
yeah,
sure. Mechanically, because we're just looking at the structure of the uterus and the fallopian tubes and the ovaries. If there is a lot of compression around those organs, it's a very delicate system. So if if there's a lot of tension in that area, it can impede implantation. So absolutely, yes, balancing the uterus and making sure that is in good health is so important.
So that's great. So someone who's maybe like looking into other reproductive technologies, like it might be a good resource to consider at least meeting with a pelvic floor therapist just to see if it makes a difference.
Right. Yes.
So obviously we've covered so much and
Yeah.
I've learned a ton and I'm sure everyone listening has as well. But obviously if someone is experiencing any sort of curiosity or potential concerns about their pelvic floor, seeing a pelvic floor therapist is the best thing they can do, at least seeing if it's something that would be beneficial. But is there anything that we can leave people with today, like something simple that people can just start so they can kind of start being aware of their pelvic floor and like what they can do? Is there anything we can leave people with today?
Yeah, absolutely. So one of the things that I will always tell people is to test themselves, and a very easy way to do that is to actually put your hand right on your perineum. So we can use this little model here. And so you have your vaginal opening and your perineum right here. Your clitoris is up here. So one thing that's very easy to do, you can do it sitting or laying down, is to actually look at your perineum. You can either look with a mirror or your phone, or you can just put your hand there to have some tactile feedback and get a sense of what the tone feels like, and then try and do a Kegel and see if you can see the perineum lifting away from you. It should be coming up into the body, and then see if it can then come back to baseline. And then you want to try and bear down and see if you can see a lengthening there, almost like a popping out of the perineum even more. So that to me is
first, let's just clear I know we're pointing to the perineum, but is there another way people can locate their perineum if they're like, I don't know what a perineum is?
The perineum is the stiff tissue between the vaginal opening and the anal opening.
There you go. So right in between the two.
Yes.
Is that like what people colloquially would call like a taint, or is that just like way off base?
Yes.
Okay. Just in case that word is better for you, because some people call it that. Okay, great.
Yes.
Sorry, I know, but we got to meet people where they're at. People have different vocabulary. And then, and then just explain really briefly how people can know if they're like doing the Kegel thing right too when they're testing.
So either, again, visually or putting your hand there to have some type of either visual feedback or tactile feedback, you want to see that you're getting movement there. And so if you find that like when you go to look, you can't see your perineum because it's super tucked up, that may be a sign that your pelvic floor is tight. Got it. Because the muscles are pulling more so internally, and it's creating a stiffness there. So if you are having if you're doing that and you're not seeing anything move, that again might mean that you have a little bit of a coordination issue. So,
and like doing the Kegel would be just like squeezing those pelvic muscles. Like what, and just so like people really understand what that means, it's like, can you explain like what that should kind of feel like when you're kind of like squeezing those muscles?
A good way to test is on the toilet, like while you're urinating, if you're able to squeeze those muscles and stop the flow. That's also a good test to see like what your coordination is looking like in the pelvic floor. I wouldn't suggest doing that all the time because I wouldn't want you to end up with like a UTI or a backflow consistently, but it is a good way to test yourself every once in a while just to see like what the muscles are doing.
See if you can start and stop. Oh,
yeah.
Very interesting. Well, good. So, I think that's great. Thank you so much for all of these explanations. And is there anything else that you want to make sure that we like leave people with today? If there was like one thing you're like, this is what I need you to take away from today.
Yeah, I think the biggest thing is that the pelvic floor is just so involved in your overall health via the nervous system. And so one of the ways if you're having any type of pelvic floor issue is just tapping into your breath and seeing if you can take a big breath and feel everything expand and then contract up and in. Because if we can reverse engineer what the pelvic floor and our entire body is doing by the way we are handling our breath, it can solve a lot of issues. So yeah, I think that's it.
That's interesting, fascinating. So take a lot of deep breaths, sexy besties, and regulate that nervous system. Thanks for joining us, and we'll see you next time.